So I'm Neeraj Bhasin. I'm a consultant vascular surgeon here at Coaldale Huddersfield Foundation Trust. I did my general sort of basic and higher surgical training through Yorkshire, and then was fortunate enough to get a job within the trust. I started in December 2011. I've been here for just short of 4 years now and found it an excellent place to work, really. I think the trust is very unique. It has a number of unique factors which are different to all the other hospitals that I've worked in through the region, and also even when I worked down south as part of my house jobs. The nice thing about this trust is that it's big enough that it does some really good complex surgery, and the cases that you do are very good, but it's actually small enough that it's still retained a very personal feel to it and a very friendly working environment. I think the working environment at the trust is sort of unlike other places in that things are done still on a very personal level, and sort of a couple of examples of that which really helps me as a consultant are that if a consultant intensivist from intensive care wanted me to see a patient, and instead of phoning me up and it being a faceless referral, he actually came down to day surgery himself whilst I was operating and just popped in and said, explained the case to me and said, I'd really like you to come and have a look. And those interactions are really what makes working here a very good thing. Sort of another quick example was I had a very complex case, and what I managed to do was you can just pick up the phone to the consultant physician who was on call, the person who was covering anaesthetics, and one of my colleagues, and within 10 minutes there was 3 consultant colleagues there giving their opinion on this very complex patient, which makes your working life a lot easier. And like I said, makes those interactions, it makes it such a good place to work because of those interactions, really. I think the most important thing about your job that I've found is that treating, whether it be a chest infection or treating an aneurysm, is the same whichever hospital you're working. But actually what makes most differences to your working life is your colleagues and the working environment. And that's what I've found is so good within this trust, that there's challenges within the NHS wherever you go, but everyone seems to be pulling together, and everyone I've found, and not just the medical teams, the nursing teams, secretarial teams, everyone's really helpful, and it creates such a great working environment, and that's the special thing about this trust. In terms of sort of outside of your everyday working, the other thing is, again, that's sort of unique about the trust is that there's a very sort of open door policy with the management team. And what I mean by that, if you've got any concerns, if you've got any ideas or service development ideas, actually I found it very easy in terms of the clinical directors, divisional directors, and even with the trust board, to actually go and see them first off, discuss these things, and actually if you could go to them with a sensible idea or sensible idea of service development, they're actually very encouraging about that and will provide you with the resources and support to actually build on that, which again supports your own personal development as well. Something that's very unique about our trust is you've got 2 hospitals. In general, if you look at all the hospitals that I've worked in and trained in, they're not in, they're in sort of quite challenging areas as a whole. And what Huddersfield and Halifax has is that the hospitals are actually right in the middle of very nice areas with very nice housing and really good schools locally. And for me, what that means is that it's excellent when you're on call because you're within a stone's throw of the hospital. And for me, with 2 small kids, what I can do is I can leave my house at 8:10 in the morning, drop both my small children actually physically into their classroom and be at work by 8:30. And actually what that does is it gives me a really good work-life balance, because little things like that are what makes the difference. And actually if you're having to commute 20 to 30 minutes every day to get into your hospital, it perhaps takes away your ability to do that. It perhaps changes how you deal with your on-call and whether you have to stay in the hospital. But because of the immediate environment to these hospitals, it means that it sort of naturally leads you towards a bit of a better work-life balance and makes your on-calls a little bit better because of that as well, because you can just pop home in between cases or when you're waiting for something. So I think that again is quite a unique, positive thing for this trust and the location of the hospitals. Huddersfield as an area, it's got really good parks, it's got, I go and watch the football, the rugby locally, it being the birthplace of rugby league. And it's also really well located. It's exactly halfway between Leeds and Manchester, so in terms of shopping, restaurants, theatres, nightlife, whatever takes your fancy, there's something within striking distance just for an evening going west or east. You've got huge areas of shopping and, like I said, all the different restaurants and everything. So the location of Huddersfield is enough just within Huddersfield itself, but also you've got such easy access to two major cities either side of you in a short drive. And even just slightly further afield, within an hour, you can be in the North York Moors, you can be in the Dales, out on the coast. So when you're wanting to relax, when you're wanting to do something different, you've got access from within Huddersfield and Halifax. You've got access to so many different activities, such a diverse activities, sporting events at a very short distance. And again, that's a real positive for me in terms of the trust and the area. People who are considering working here, what I found, having been here 4 years, that actually, like I've said before, the things you deal with are the same in any hospital, but the working environment here is very friendly, close-knit and personal. So the working environment is a real positive for me. Outside of that, the sort of wider area also naturally gives you that work-life balance. So I found working here with the medical teams, the management teams, I found it a really positive experience, and it's been an absolute pleasure working within the trust.